Hi, my name is Megan Myers. I'm a genetic counselor at the University of California in San Francisco, and I also run a family communication and education website called kintalk.org for families who have hereditary conditions. And today I'm going to be talking about hereditary breast and ovarian cancer syndrome. It is one of the most commonly inherited breast and ovarian cancer syndromes, and it's due to the BRCA1 and BRCA2 genes, or also called the BRCA genes. In the United States, we believe that about 1 in 500 people actually have hereditary breast and ovarian cancer syndrome due to a change in their BRCA1 or BRCA2 gene. People who have hereditary breast and ovarian cancer syndrome have an increased lifetime chance for developing certain types of cancers. As the name hereditary breast and ovarian cancer syndrome would apply, those cancers include breast and ovarian cancer as the core cancers associated with this condition. An individual with hereditary breast and ovarian cancer syndrome has up to an 80% lifetime chance to develop breast cancer, and up to a 40% lifetime chance to develop ovarian cancer. These cancers are developed at earlier ages in someone's life compared to that of the general population. And an individual can develop more than one breast cancer within their lifetime if they have this condition. Other cancers associated with hereditary breast and ovarian cancer syndrome include prostate cancer, male breast cancer, pancreatic cancer, and melanoma or skin cancer. Hereditary breast and ovarian cancer syndrome is a condition that is caused by a genetic change that we call a deleterious mutation or a disease-causing mutation in either the BRCA1 or the BRCA2 gene. A gene itself is a hereditary unit of DNA. Genes carry directions to cells and tell them to make specific proteins that perform and regulate all functions of the body. Genes are capable of replicating themselves at each cell division. A mutation is a change in the usual DNA sequence of a particular gene. Mutations can be beneficial, harmful, or neutral. Many diseases, including cancer, begin in the genes. Genetic mutations can be inherited from a parent or can be a random event that occurs in one single cell during cell division, or even in response to environmental factors and exposures. But with hereditary breast and ovarian cancer syndrome, we know that there is a deleterious mutation or a change that causes the BRCA1 and BRCA2 genes not to work correctly. So what are the BRCA1 and 2 genes? What are their jobs? Well, the actual name BRCA1 and BRCA2, they stand for breast cancer gene 1 and breast cancer gene 2. Everybody has copies of these genes. Sometimes people will say, oh, we got the gene. We got the breast cancer gene. Well, actually, everybody has the BRCA1 and 2 genes, and we need these genes. They help our bodies to not develop cancers. And when these genes are not working correctly due to genetic mutations in them, that's when an individual will develop these breast and ovarian cancers and will ultimately develop hereditary breast and ovarian cancer syndrome. So how can you find out if your family has hereditary breast and ovarian cancer syndrome? Well, first of all, family history and personal history is key. So just from a hereditary cancer standpoint, we know that families who have hereditary cancer syndromes have often a family history that includes multiple generations affected with cancers. And usually these cancers, there's specific types of cancers that fit a certain pattern. And these cancers are often diagnosed at younger ages. Individuals within these families will often develop multiple cancers within their lifetime. So specifically for hereditary breast and ovarian cancer syndrome, certain red flags that we would look for within a family history would be breast cancer diagnosed under the age of 45, ovarian cancer diagnosed at any age, breast and ovarian cancer diagnosed in the same woman, bilateral breast cancer diagnosed in a woman of any age, anyone who is of Ashkenazi Jewish ancestry. And the reason for that is because individuals of Ashkenazi Jewish ancestry have a much higher chance of actually carrying a mutation in one of their BRCA1 or 2 genes. And also, if there's a male breast cancer in a family, if a family member is known to carry a BRCA1 or 2 gene mutation, sometimes when we look at a family history, we'll find that even though there might be hereditary breast and ovarian cancer syndrome in the family, there isn't what we call a strong family history. And this might have to do with the fact that the family itself is very small. There's only a few members in the family, or there's predominantly men in the family. And although men do indeed have and can carry a change in their BRCA1 and 2 genes and have hereditary breast and ovarian cancer syndrome, their risk for breast cancer, although it is increased in a man, it's not as increased as it would be in a woman. So sometimes we may just see one breast cancer in the family or one ovarian cancer in the family, but we see that there's also lots of men. So if you have a family with many men and only a few women, but some of those women have developed a cancer, it's still a good idea to talk to your doctor about it. So some of the steps that you can take to find out if you have hereditary breast and ovarian cancer include starting a conversation with your doctor or a genetic counselor. So you want to talk to someone who specializes in hereditary cancer syndromes. They'll have the tools that they need to take a good family history and determine whether or not you meet criteria for genetic testing and what type of genetic testing or testing that you would need. And sometimes, we'll talk a little bit more about this, but sometimes it might not be you that they recommend testing for, but another family member who would be a better candidate for genetic testing because they have a cancer maybe and you do not, but they have a higher chance of us actually finding a genetic mutation or change in their gene that would help us determine whether or not there's a hereditary cancer syndrome in the family. So we want to talk to that genetic specialist or your doctor, and hopefully they'll refer you to a genetic counselor. And when you meet with that genetic counselor, make sure that you have talked to your family and you know your family history, because that's the first thing your genetic counselor is going to want to do, is take a detailed family history. And once they take that detailed family history, they're going to, like I said, look for certain patterns in the family, as I had discussed previously. Early onset of cancers, multiple cancers in the family, especially breast, ovarian, pancreas, melanoma, and prostate cancers. And based on the patterns in your family, they may want to offer you genetic testing. Genetic testing is a very simple test. It involves either a blood draw or you would provide a saliva sample. And these samples would then be sent to a genetic laboratory where the laboratory would look at the BRCA1 and 2 genes for any mutations or changes in these genes that would cause them not to work correctly. Now, with new genes being discovered all the time, we're finding that the BRCA1 and 2 genes are not the only genes that cause hereditary breast cancer, hereditary ovarian cancer, and just hereditary cancer conditions in general. So it may be that your genetic counselor recommends that you have multiple genes tested or looked at to see if they could be causing the cancer in you or the cancer in your family. And this is what we call a panel test. It's a more streamlined way that we are doing genetic testing now. So let's talk about the types of test results that you can receive when you have a genetic test. You can have a positive test result. Positive meaning they have found a change in your BRCA1 or 2 gene, and it is the cause for the cancers in you and the cancers in your family. So positive for a deleterious mutation in your BRCA1 or in your BRCA2 gene. And this would mean, of course, that you have hereditary breast and ovarian cancer syndrome. The second type of test result that you can receive is a negative test result. That means that they looked at your BRCA1 and your BRCA2 gene, and there was no change or mutation found in the gene. Now, that doesn't always mean that you don't have hereditary breast and ovarian cancer syndrome. As of right now, genetic testing is not 100% accurate, and there are times that we can miss changes or mutations within the gene due to limitations of genetic testing. So it's important that you meet again with your genetic counselor to talk about if there is additional testing that they would recommend, or just based on your family history, if there is certain types of screening that they would recommend, even if you have a negative test result. The third type of test result that you can receive through genetic testing would be a VUS, or a variant of uncertain significance. And a variant of uncertain significance means a mutation was found, but we don't know what that mutation does to the gene. We don't know if it changes the function and causes it not to work, or if it does nothing to the gene at all. And if this happens, usually what your provider, your genetic counselor or medical provider will say is that they're going to have to check in with you. There's nothing that they are going to do. They can't say that you have hereditary breast and ovarian cancer syndrome, and they can't say that you don't have it. And it's something that you as a patient really want to follow up with your genetic counselor in the future to see if there's been any changes or any reclassifications in that variant of uncertain significance. So if you find out that you do have a positive test result and that you do indeed have hereditary breast and ovarian cancer, what are some ways that you can reduce your risk of these cancers? Well, let's first talk about breast cancer screening. So first of all, breast cancer awareness is very, very important. We say we want our women who have tested positive to really be familiar with their breasts and do their own self-breast exams and have clinical breast exams starting at the age of 25. Although we say that clinical breast exams start at the age of 25, having that breast awareness is very important starting at the age of 18. We also recommend a mammogram and a breast MRI starting at the age of 25 as well. So they would have annual breast MRIs and annual mammograms, so every 6 months alternating between these. In terms of ovarian cancer screening, some physicians feel that ovarian cancer screening isn't very good. The tools we have are limited, and they feel that there really isn't a need for ovarian cancer screening. However, some physicians still recommend ovarian cancer screening, and this screening would include a transvaginal ultrasound, and they would also recommend a CA-125, which is a blood test looking for a specific marker in the blood associated with ovarian cancer. Most importantly, what you want to do is really educate yourself about the signs and symptoms of ovarian cancer, as they can be very vague. But if you know that you're at an increased risk for ovarian cancer and you know what signs and symptoms to look for, you have a much better chance of catching ovarian cancer at hopefully an earlier stage. For men, we recommend that they have a baseline mammogram for the risk of male breast cancer. And they don't need to have annual mammograms, but we just want to have that baseline mammogram in case there is a lump found in their breast tissue later on. In addition, for men, we recommend that they have prostate cancer screening starting at the age of 40. And then for both men and women, we recommend annual skin exams for that increased risk of melanoma, especially for those who have a BRCA2 gene mutation. In terms of chemopreventative drugs, tamoxifen and raloxifene are drugs that are known as selective estrogen receptor modulators, and they may be used to reduce the risk of breast cancer in women at high risk for the disease. Another chemopreventative drug that's recommended are birth control pills, as they have been found to reduce the risk of ovarian cancer. In terms of risk-reducing surgeries, bilateral mastectomies are one way to reduce a woman's risk of breast cancer by 90%. We can't reduce a woman's risk of breast cancer all the way down to 0% because there's still some breast tissue that may be left during the bilateral mastectomy. Another risk-reducing surgery to reduce the risk for ovarian cancer would be bilateral salpingo-oophorectomies. So bilateral salpingo-oophorectomy means a surgical procedure to remove your fallopian tubes and ovaries. This procedure is typically performed before menopause, and we typically recommend once childbearing is complete or by the age of 40. Now, when a woman removes her ovaries and fallopian tubes, she again dramatically reduces her risk of ovarian cancer by at least 90%. And she also reduces her risk of breast cancer by about 50% if she does this procedure before she begins menopause. Before somebody decides to undergo these types of surgeries, it's really important to speak with your GYN oncologist or just a gynecologist to talk about the effects of surgical menopause. Some women have a very easy transition from being hormonal to going into menopause. So you want to have a team of experts supporting you and helping you as you make that transition. And so it's always really important to talk to health educators and providers before making any sort of surgical decision. Hereditary breast and ovarian cancer syndrome is a family affair. It's very important that you share your genetic information with your family members, since they themselves are at risk for hereditary breast and ovarian cancer syndrome. There are things that they can do to greatly reduce their risk or prevent the risk of cancer if they know that they have the condition. And those are the things that we had just mentioned earlier with chemo prevention and cancer screening and risk-reducing surgeries. It's also important to share this information with family members, even if they've already had cancer, because there are certain clinical trials, such as the PARP trial. PARP inhibitors have been shown to potentially help people who have BRCA1 or 2 genetic mutations to fight their cancers. So you need to share your results, and you can share them through an email, a phone call, share them face-to-face, recommend that they see a genetic counselor, and you can also share them with our family communication tool on kintalk.org. So if you yourself have hereditary breast and ovarian cancer syndrome, you know your family members are at risk, including your children. If you test positive, it means that your children have a 50% chance of inheriting the change that you have as well in your BRCA1 or your BRCA2 gene. It doesn't matter if your child is male or female, they have that 50% risk. Your brothers and sisters are also at risk. So you want to make sure that they speak with a genetic counselor and decide whether or not they'd like to undergo genetic testing. We recommend genetic testing for people 18 years or older. If you don't have children and you're worried about passing on your BRCA1 or BRCA2 genetic mutation, there are things you can do to prevent the gene from being passed on to your children, and it's called pre-implantation genetic diagnosis, or PGD. If you're interested in that, I would recommend that you speak with a fertility specialist about that, as well as your genetic counselor. You can also read a little bit more about that on kintalk.org. The bottom line is, with hereditary breast and ovarian cancer syndrome, is knowledge and education is power. You need to talk with your doctors if you're concerned that you may have hereditary breast and ovarian cancer syndrome, and make sure you get that family history so that you can give that accurate information to your genetic counselors and to your doctors. If you have any questions about hereditary breast and ovarian cancer syndrome, please feel free to visit us at kintalk.org and post your questions, or you can also read more and educate yourself about the condition there. There's also wonderful resources about hereditary breast and ovarian cancer syndrome through different advocacy groups. One would be called FORCE, and another one is called Bright Pink. Thank you so much for the opportunity to speak about hereditary breast and ovarian cancer syndrome. I look forward to talking more about hereditary cancer conditions later. Thank you.